Greetings. This is Justin Allen with the Elite Nurse Practitioner. Welcome to the Elite Nurse Practitioner Show. Today we are going to be talking to a successful advanced practice nurse. Normally our episodes are consultation calls with nurse practitioners who need help, but we are going to have some episodes where we interview nurse practitioners and advanced practice nurses who have developed a successful business. We will talk about the pros and the cons of starting businesses, issues they have ran into, and everything in between. So I hope these episode types help nurse practitioners out there understand how to create a successful business and to know that there are other successful nurse practitioners out there that have done it. All right, and on to the episode. Hello, everyone. Today we'll be talking to Erica with the Burned-out Nurse Practitioner. Erica is a family nurse practitioner who works at a critical access hospital doing primary care and emergency medicine. She's the owner and operator of the blog, Th Burned-out Nurse Practitioner, and also recently started the NP Charting School, where she provides weekly articles on how to combat burnout and also provides a variety of courses to help the nurse practitioner prevent burnout. We'll be discussing burnout and how it applies to nurse practitioners and how to overcome it. Hey, Erica, how are you?
I'm good. How are you doing?
I'm doing good. Thanks for hopping on here. I know we've been chit-chatting for the past year and a half, 2 years. And yeah, it's pretty cool to see what you've built with the Burned Out Nurse Practitioner.
Yeah, thank you for having me. And I just want to say from the entire nurse practitioner community, thank you so much for all that you do. You have empowered and educated so many nurse practitioners, and we just really appreciate it. You've changed a lot of NPs' lives.
Yeah, no, thank you. I love hearing those stories. Every single time I get an email or a message or whatever. It's crazy to think that this thing that I started a couple years ago is turned into this, and just like hundreds of MPs have started their own business, and it just blows my mind. So, but yeah, thanks. It sounds like you're doing a pretty good job yourself over there helping nurse practitioners with burnout and stuff. So just tell us a little bit about yourself and, kind of what provoked you to start that blog.
Yeah, so I am a family nurse practitioner, as you said, a wife, a mom of two. I became an RN in about 2013 and worked in few different areas: med surge, neurotrauma, cardiac rehab, and then started working at the critical access hospital that I work as a FNP now. My burnout story kind of started about 2 years into nursing. I was working as an RN on a busy acute care floor. I honestly didn't even know that I was burned out until I read an article on compassion fatigue that was just in the lunchroom at work. And I read through it and check marked pretty much every single sign and symptom. I just felt physically, mentally, emotionally exhausted. I dreaded going to work. I no longer had that compassion for caring for my patients. I just started to feel detached from my work, from my family, even from myself. I just felt like numb and just the lack of purpose and completely burned out. So after time, I eventually overcame that burnout and got my FNP. And then I realized how many other nurse practitioners were struggling with burnout. And we were burned out before the pandemic, and then that just changed everything. So I just wanted to be that voice and empowerment and support for nurse practitioners to create a better work-life balance and conquer that burnout.
Yeah, I think this applies to probably most nurse practitioners or RNs out
Yeah.
there. I don't know of one that doesn't feel some kind of burnout. I just don't think we were designed to work in the current healthcare environment. You know what I mean? Like, I just don't think humans were designed to see the amount of patients that we're seeing. Like, this conveyor belt of healthcare is just unnatural. You know what I mean? Like,
Yeah.
no other time in human history has a single person had to sit there and see 30, 40, 50, 60 sick people in one day. Like, never. You know what I
Mhm.
mean? You were the county, or the little country doctor or whatever, you'd see 3 people in one day or
Mhm.
something, like, yeah. So I
Yeah.
think it's just an inevitable thing, don't you? I mean, I don't know how you get
Oh,
around it.
yeah. Yeah. There's so many risk factors. Healthcare is just a caring, compassionate field. And so when you care for other people and you're not taking care of yourself, I mean, that causes the risk for burnout. And then, yeah, like you said, I mean, there's so much push from administration to see more patients and the charting and all the other tasks, and having patients be so accessible to you, through the chat functions and messenger functions. And there's just a ton of different risk factors for burnout.
Yeah. What do you think is probably the biggest risk factor?
The biggest like cause that I have seen is charting. Like so
Really?
many nurse practitioners come into work early. They are busy all day. They stay late. They are bringing their charts home, which disrupts, their family and personal time. And that has been the number one thing that I've seen cause burnout.
Charting. Interesting.
Mhm.
I wouldn't think that. I would have thought of it been like just the amount of patients that you see, but I mean, I get it. So I guess if the nurse practitioner can efficiently chart better, then the mental energy can now be focused on, I guess, treating the patients and stuff instead. And that doesn't really lead to the burnout. Is that kind of what you've seen? Or
Yeah. And I mean, like you said, the more patients you see, the more charts you have to do. And, if your administration doesn't allow extra time to get those charts done, they only care about the numbers and not actually getting the charts done. The main cause of that is just the amount of workload. So then when you have to stay late or bring that home, I mean, you don't have time to decompress or to take care of yourself or to, spend time with your family. And so that ultimately causes the burnout.
yeah, that makes sense. So you're just never really truly getting away from it.
Right. Yeah.
Can't reset. Yeah. No, that makes sense. What are some other big risk factors outside of charting that you've seen?
I would say toxic work environment. So, if you're going to work and there are people that are making it, not fun to be there, not a healthy environment. Also, your support, from administration. Are they giving you your own MA or nurse to help, do some of the phone calls? Or are they offering, shortcuts to your charting system? Or are they just pushing you to see more patients and, you don't have any admin time or any time to get some of these things done.
Gotcha. Interesting. So, do you not really see just the sheer volume of patients leading to it? Because I mean, that's what it was for me.
Yeah, I mean, that definitely does play a factor because you just don't have time to, truly care for the patient. And I think that's why most of us went into healthcare from the start, to like make a difference and educate your patients. And that's not always the case. And then if you are throwing on all these patients, just seeing the volume of patients, I mean, you don't even have time to breathe, it seems like. So yeah,
Ye-
that can be a huge factor.
Yeah, I know that was one of the biggest ones for me. So, I mean, I've done urgent care ER for it was like 9 years or something. I mean, almost a decade. This would have been 2013 or so, 2012, 2013. When I first got started, it was reasonable. There was two
Mhm.
providers. The amount of patients that came through the door for an entire 12-hour shift, even during busy times like flu, would have been 60 patients, in a 12-hour
Mhm.
period of time, which isn't that much for two providers.
Mhm.
That's really not that much. 30 apiece in 12 hours, that's really not that much, right?
Mm.
And so that's what I saw in 2013. And it kind of stayed that way. It got a little bit busier a couple years. And then I don't know what the hell happened, but after like, I don't know what it was, but like 2016, 2017 or something, like the floodgates just opened. It was just like,
Mm.
where are all these people coming from now? And they would come in for everything, anything. And then you got healthcare administration cutting costs and
Mhm.
stuff. And then now it's only one provider. Now you got to see 60, 70 patients by yourself in 12 hours. And, I did this for, oh God, 4 or 5 years. I don't know how the hell I did it looking back. I have no clue, I just got burned out. I would get to the point where I'd walk into a patient's room and just be totally stone faced. Like, you know what I
Mhm.
mean? No
Mhm. That
compassion, no,
detachment, yeah.
totally
Mhm.
detached. What is it? I mean, I was cutting corners. I mean, it was awful. So starting my own business
What
was the only way to escape. It was the only way I could escape.
Oh, yeah.
Yeah.
Yeah. Just to be, like, in control of your life. That was a huge thing for me to, like, overcome the burnout, was realizing that, like, I'm the one in charge of how I feel and, how I show up to work every day.
Right. You can either
Yeah.
go in with that feeling or I guess, try to make it positive, I suppose, the
Mhm.
mindset change.
Yeah.
How does a nurse practitioner do that though when there's just so overwhelmed with work? I mean, is it even possible?
Yes, it is. In like small steps or small changes. I will say that I have talked to several nurse practitioners who were so burned out, they either like quit their job or they asked for time off just, to be able to take a breath. So whether that was 2 weeks off from work or 2 months. They were able to do that by like talking to their clinic manager and just, describing how incredibly burned out they were and how it was affecting their personal life, but also their clinical practice. So that was something that I definitely recommend if you are just completely burned out. But really, the first step is just becoming aware that you're burned out and kind of figuring out what exactly is causing that. And then developing, the small habits and changes that you can do to overcome that. So for me, self care and kind of like a personal development that was huge. So, like I said, realizing that I'm in control of how I feel, and then just making sure that I'm doing the self care and filling my cup up. And, for me, it's exercise, but for you, it might be, spending time with friends or, just having that time to relax and recover. I mean, that was a huge thing for me.
Well, that makes sense. Yeah, I feel like I was always recharged after a vacation
Mhm.
to an
And I
extent.
mean, it's important to take those vacations, but you also need something like on the daily basis so that you don't, become so burned out and just have to wait for that vacation. It's to make those, daily changes to help overcome that burnout.
Well, what can you do? I mean, obviously exercise and proper diet and stuff is critically important. I don't care who you are or what you do. Like, it amazes me how just out of shape and unhealthy people are,
Mm.
especially people in nursing. It blows my mind. So, I mean, that's obviously something you could do, right? Stay in shape,
Yes.
exercise, eat right. Yeah. But I mean, what are some other
Yeah.
things that you can do on a daily basis? Because I mean, for me, there was just nothing other than quitting. Like, it doesn't matter how many vacations I took, I always dreaded going back. You know what I mean? Like, I was recharged for a day or 2, and then it was just right back to it. So, like, what are some other things that on a day-to-day basis people could do?
I would say a huge one that I've seen like in healthcare is a lack of boundaries. And so sometimes that's, with your administration or even like with patients, when patients just call and ask for an antibiotic or like ask for something, like you really need to just set that boundary and say, why don't you schedule an appointment so that you have that, time blocked off and so you can talk about it. I know a lot of nurse practitioners are struggling with patients messaging them, like with a lot of the charting systems, have that kind of instant messaging. And so that has been like a huge issue. And that takes nurse practitioners time and they're not getting paid for that. So I've encouraged nurse practitioners to kind of set the boundaries and expectations between that and letting the patient know that they cannot be reached by that. And if it is a significant issue, they need to schedule an appointment. So setting boundaries is a huge one. I also think like being a people pleaser. So I really struggled with that. Like I would always put everyone else's needs first before mine. And you just can't do that, day after day. You cannot pour from an empty cup and you have to do, the things like we talked about the self care and recharging. You have to do those things in order to care for other people.
Yeah, well, that makes sense, especially the boundary thing. I mean, I see questions on the Facebook group all the time about, how some nurse practitioners are just being driven crazy by some certain patients or whatever. And it's just like,
Mm.
set some boundaries. Even if it's your own business, like, this is your own business. Why are you letting these patients do this to you? Like, this is your business. You operate how you want to operate. You have to set boundaries. Like, nurse practitioners who give their patients their cell phone number, that is just insane to me.
Oh,
Why would
yeah.
you do that?
Yeah.
Yeah, you're asking for burnout.
Yes.
I mean, come on, you can't
Yeah.
get away from it. Yeah.
Right. And I think patients need to realize, that they can't have accessibility to you 24/7. And so, I mean, for like the nurse entrepreneur with their own clinic, I would like set those boundaries from the start, say if you have a question, it will be answered during regular business hours. Like, do not give out your personal email or cell phone or any of those things because you need that time away from the business and from the patients, and patients need to be aware of that.
Absolutely. And these patients don't think that we have a life. They think this is our life. We don't do anything
Mhm.
else but healthcare. And it's like, no, like,
Yeah.
we have families, we have hobbies. Like, there's things that we do. This is not our life. No, no, I think those are all good tips. I really do. I guess, what's the craziest burnout story you've ever heard?
Oh, man. I don't know that I've had like a super crazy one, but I mean, I just hear a lot of the same things. These nurse practitioners want to spend more time with their family and they're just exhausted from seeing so many patients and doing all the medication refills and reviewing documentation and the patient messages. And I mean, there's so many things that they do every single day. So I don't know that I've had like a super crazy burnout story, but it's basically all the same.
Usually the same stuff it contributes to it,
Yeah.
yeah. Well, I guess that makes it easy for you to assess a potential client's needs because I mean, it's pretty much usually
Mhm.
the same story over and over again. So I'm assuming you've developed ways to kind of help the nurse practitioner combat this then, yeah?
Yes.
So I guess what is it that you do then, I guess? What is it that you do with the burned out MP? I know you write articles and whatnot to help. I guess what are some other things that you do?
Yeah, so through the Burned-out NP, I have a online course about overcoming nurse practitioner burnout. I also have one on imposter syndrome, which is
Mm.
super huge. I mean, for nurse practitioners of all years experience, I mean, so many really struggle with those negative feelings and feelings like they don't know enough or they're not good enough. And then I have another course on contract negotiation for nurse practitioners and basically, just standing up for yourself and knowing your worth and kind of working through that negotiation through a contract. And then through the nurse practitioner charting school.
Yeah, let's talk about
Yeah.
that. I know you just started that. So let's talk about a little bit about that too.
Yes. Yeah. So, like I was saying, I constantly heard that charting was, such a major issue with burnout. And so I kind of reflected like on my own charting experiences and journey and realized how little we were taught in school about charting in general. Like, I think I had maybe one 45-minute lecture in school on how to chart and like how to bill and code and everything all together. And so when I first started as a nurse practitioner, I struggled like with the time management, with knowing how to code, all of those things. And so I really had to like educate myself on how to do those things and how to write, a solid chart note that's going to stand up in a malpractice case but also not, too wordy and take you forever to write. So I realized that a lot of nurse practitioners were struggling with those types of things as far as charting. So that's why I launched the nurse practitioner charting school.
Yeah, no, I like that. Nurse practitioner school, they really do our profession a disservice in not teaching us how to actually like work. You know what I
Work.
mean?
Oh,
Like
yeah.
they teach you very little about it. Like I think
Yeah.
there should be a course, basically practice integration or something, like how to actually like do
Yeah.
your job.
Yeah.
Like you understand the medicine, the healthcare, I mean, like you understand that kind of stuff, but like the actual job. And I think honestly, probably most medical professions do a very poor job of doing that. You know what I mean?
Oh, yeah. Yeah,
Yeah.
I've talked to physicians that have said, "No, I didn't learn how to, like, chart in school. You're just kind of expected to know that and just kind of
Right.
learn as you go," and
Yep.
yeah.
Yeah. Yeah. I've heard that from PAs and RNs. I mean, I hear it time and
Mhm.
time again as well. Yeah. Yeah. I think it's really awesome that you're doing that. I think that a lot of nurse practitioners could definitely benefit from learning how to chart appropriately. I mean, I think you either naturally got it or you don't. My opinion, this is just my opinion, is that I think charting less is more. You know what I mean?
Mhm.
I read some other people's notes. I'm like, what the hell is all this that you're talking about? Like, I don't understand how any of this is relevant to their complaint. Like, I've seen charts about a sore throat that were just absolutely ridiculous in length. Like, why are you charting about all this stuff? It doesn't make a difference. So I guess that's kind of one of those things like, how do you determine what's relevant, what's not to put in the chart? I think that's maybe one of the underlying issues because people just don't understand that. You know what I mean?
Yeah, and it does take some practice to kind of develop that. I recommend having a problem-focused note. So there's the reason, the chief complaint why that patient came in, and so your note should be very focused to that chief complaint. Of course, if it's like a wellness visit or something, that's a little more comprehensive, but, yeah, I mean, I've seen some chart notes that just are way too long, and it took that nurse practitioner, 20, 30 minutes to write it. And so that's taking extra
Right.
time and causing them to be burned out. And
Right. Right.
yeah,
And taking that time for writing something that no one's ever going to read.
right.
Like
Yeah.
it's literally it's a waste of time. It's
Yeah.
wasted work. No one's ever going to read that note.
And if they
Yeah.
do, they only read the plan to figure out what you did for that patient.
Right. I've seen ankle sprain notes a patient presents with an ankle sprain and the nurse practitioner documents that they looked in the patient's ear. Like, what?
Oh,
Why?
yeah.
That doesn't make
Yeah.
any sense to me. Like,
Yeah.
yeah.
And I mean, from the billing standpoint, with the 2021 E&M changes, they took all that out. Like, you no longer need a certain amount of review of systems or the physical exam. It says a medically necessary note. So you don't have to look in their ears, just to get that point from like the coding
Right.
perspective.
Well, that's good to know. I mean, a lot of that was just
Mhm.
total nonsense, just to upcharge.
Oh, yeah.
I want us to go back around to this imposter syndrome real quick. Just tell us a little bit about that. How would you define it?
So imposter syndrome is just the feelings or thoughts of disbelief and that you're an imposter and someone is going to figure you out and that you don't know enough. You might not feel like you're smart enough to be diagnosing and treating patients, just that negativity mindset.
Gotcha. So you feel like you shouldn't really belong there.
Correct. Yeah. And I will say that, I mean, I've talked to, nurse practitioners with 20 years experience and I mean, new grads as well. And like everybody struggles with this. There's been experienced world renowned surgeons and I mean, even movie stars that say they have struggled with imposter syndrome. And I think once you kind of like realize that everyone has these negative thoughts, it just normalizes it, and then you feel like you're not crazy for, having that imposter syndrome.
No, I mean, I've suffered from that too. Like the first course I ever created, like, do you not think
Mhm.
that I felt somewhat like an imposter? Like,
Oh, yeah.
what do I know? Like, why should I be doing this? Like, you know what I mean? Or like the very first podcast I ever recorded. I mean, that's
Oh,
literally
yeah.
the very first podcast I ever recorded. You know what I mean? Like,
Yeah,
right. Like, I think
yeah.
everyone suffers from that a little bit. You learn a new clinical skill and you integrate it into your practice. You might feel like an imposter. So, me personally, I just like what you said. Like, I know this is normal. Like,
Mhm,
very successful people, billionaires, presidents, Congress people, like everyone
mhm.
suffers from this. Like, this is just a part of the human condition, right? I mean, if you don't
Right.
suffer from it, then you are an outlier. So,
Mhm,
like, me knowing that helped me overcome that. And I think I just basically was just like, you know what? I know what I'm talking about. I'm
mhm.
coming into this confident. If someone thinks I'm an imposter or whatever, hell with them. I don't care. You know what I mean?
Right.
Like, I don't care what people think about me in terms of that regard. Like, you have to just kind of battle through that. Is kind of how I figured out how to do it. So, how do you
Yeah.
typically teach people how to basically overcome that?
Yeah, I mean, like you said, opinions of other people is a huge one. And so you have to kind of differentiate that in your mind. What is the actual truth and what is someone else's opinion? As like from the nurse practitioner perspective, I mean, we were trained to care for patients. And yes, some training was better than other training, but there just kind of seems to be this society thought that nurse practitioners are not good enough because they did not have the training that a physician did. And so once you kind of take a step back and reflect on your own experience, and maybe you worked as an RN and that is like super valuable experience, even though you're not using it directly as a nurse practitioner. I mean, you were still, caring for that patient and getting that exposure to healthcare. So, yeah, definitely differentiating between what are other people's opinions and then realizing how much that you already know.
Right, right. The people's opinions doesn't matter.
Right.
At the end of the day, it doesn't matter. Why worry about it?
Yeah.
You
And if
know?
you think about like how much people worry like about themselves. So if you are, thinking that you're not good enough or that you don't know enough, the other provider you work with might be thinking the exact same thing about themselves. And so I think if you kind of realize that people are, their thoughts are consumed by themselves and
You know, I think that that's a super interesting point because it's a really good point. I think that I finally broke free in my mind once I stopped giving a shit about what other people thought about me.
uh-huh.
Like,
Yeah.
it was kind of more or less an enlightening moment of everyone else is consumed by their own problems, their
Yep.
own thoughts, their
Mhm.
own struggles, that people don't think about you as much as you think. Most
Right.
people don't give two shits about you. They really
Right.
don't.
And what does
Like,
it matter if they do? I mean,
right.
literally, it does not matter.
Right. It doesn't matter. And so, like, realizing that, it's so freeing.
Oh, yeah.
It's so freeing when you don't have to worry about it anymore. You know what I mean?
Mhm.
Like, it's like those older people that you see wearing those crazy hats and stuff. I
Mhm.
salute them. They don't give a shit. Like,
Oh, yeah.
living their best life. And I think that
Yep.
everyone, if they can ingrain that in their mind, I mean, I think your life just becomes so much better.
Oh, yeah. In nurse practitioner practice, and I mean, business too. Like, you are in charge of your business and you control how you run that business. And it doesn't matter what the provider next door thinks about you or a family member thinks. Like, you have to be true to yourself.
100%. I've gotten emails before from, some nurse practitioners that this doctor across town is talking, smack about me and, all this kind of stuff. Who cares?
Yeah.
Why are you worried about this? Focus on your own business.
Yes.
Like,
And I
yeah.
bet that physician down the road had some kind of insecurity. So, maybe they were jealous that that nurse practitioner went out and created their own business, or, maybe they felt insecure about that kind of treatment or whatever. So,
You can guarantee it. You
yeah.
guarantee that's the reason? All right. I hope everyone's enjoying the episode so far. I just wanted to take a quick break to thank everyone listening and also give a big thank you to all of my social media followers and email subscribers. If you haven't done so yet, please subscribe to our email list at www.elitenp.com and make sure to follow us on Facebook, Instagram, and LinkedIn. Email subscribers will receive updates on new weekly podcast episodes, multiple weekly articles we publish, new courses, and everything else related to helping you succeed. Remember, all elite nurse practitioner courses are designed to help you build a niche practice, increase your financial strength, and to break free from the rat race. If I can break free and that other countless nurse practitioners can break free, then so can you. Additionally, please share this podcast with your other nurse practitioner sisters and brothers out there. The more NPs that venture out on their own, the stronger our profession will become. Now, let's get back to the episode. Anyway, so let's talk about a little bit about these charting courses. I mean, I know, they're very beneficial to our profession, basically. And I really think that, I think you're onto something here. So I guess tell me a little bit about these courses. Like, what do they do for for the nurse practitioner? Is it something that would benefit a new grad, someone maybe who's
Mm.
been in practice for just a couple of years, someone who's in practice for 10, 20 years? I mean, I guess walk me through it. Like, do you have different tiers of courses or different levels of skill levels or anything like that within the courses in terms of charting goes?
Yeah, so I wanted to create the nurse practitioner charting school to be a resource for all nurse practitioners, no matter what specialty or skill set or, experience. And I honestly have found that, a lot of experienced nurse practitioners, like, yes, some things get better as far as the imposter syndrome or, the clinical knowledge and that sort of thing. But I've had nurse practitioners practicing for 20 years that are struggling with the time management and how to get their charts home without bringing them home. So the courses really kind of cover all types and levels of nurse practitioners. So I have the time management and charting tips course, which will really help with creating a better work-life balance and overcoming charting burnout and, avoid having to bring those charts home. I also have a billing and coding course specifically for outpatient visits. I'm hoping to expand that, but like I said, I mean, I knew very little about coding. I learned very little in school. And then out in practice, I did not get a lot of feedback, like, hey, am I choosing the right E&M level? What are some of the other things that need to be added? Like, what does all that mean? And then with the 2021 changes, I mean, those are just completely different than how we were choosing it 20 years ago, choosing the codes that long ago. And I have another course, legal issues with charting, because I
Mm,
think that's something
yeah.
that nurse practitioners need to be aware of and, kind of what are some of the things that should or should not go in a chart node and, how can we protect ourselves from any malpractice cases? Not that anyone is immune. Any healthcare provider can, just be in the wrong place at the wrong time and have a malpractice case come up against them. But I mean, there are some things that we can do to kind of protect ourselves. And then I also have a course for more so student nurse practitioners on kind of like how to formulate
Mm,
a actual chart note because
mhm.
again, that's really something I did not learn in
No.
school. And so I just wanted to have very helpful things for all nurse practitioners. I also have, this has been very popular, I compiled a list of smart phrases or dot phrases for all types of acute or chronic visits that once the nurse practitioner purchases, they get access to over 100 different smart or dot phrases. And so those you can easily implement into your own charting system. And those are a huge time saver if, you're constantly giving the same education or recommendations, for hypertension or even for a sore throat or, whatever it is. Like, don't reinvent the wheel. You can just use that list and compile it and make it to your own and save a ton of time instead of, retyping or re-saying
Right.
those commonly used phrases.
Yeah, no, 100%. I think that one reason why charting was never an issue for me, even I could see 70 patients at the urgent care at 8 o'clock when like the doors closed. I was out and I was done. I
Mm,
had no charts to do,
it's
none, zero.
impressive.
But it was based off of smart phrases,
Mhm,
templates, and
mhm.
macros.
Yep.
Like 100%. It would have been impossible to do that without the help of the technology. You know what I mean?
Mhm.
And
Yeah.
a very, very problem focused. No, if they came in with a sore throat, I only talked about a sore throat, and that was
Right.
pretty much it. You know what I mean?
Yeah.
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 So very, very problem focused. But yeah, no, I think the smart phrases, the macros, and the templates are critically important if you're looking to really streamline,
Oh, yeah.
your charting. Yeah. No, no, I love that. What about the legal issues? I was thinking whenever you're saying that, I guess what are a few tips that you could maybe give people about maybe like the top one or two things they can do in their charts to really prevent, I guess, a malpractice lawsuit or, basically just how to cover your ass.
Yeah. I think a few things come to mind. Having your words be very, how do I want to say, non accusatory. So, like, if that patient is refusing the treatment, you say something like, that patient declines this treatment plan, and I explain the risks and benefits and that sort of thing. I think also making sure everything is accurate. So, just looking over, making sure the vital signs got put in accurate, just basically having a professional, well written note. It does not have to be long. You don't have to explain every single thing. But, when you come to a malpractice case, the court is going to want to know that you're a thorough professional provider. If there's a sloppy note that has a lot of spelling errors or that sort of thing, that just shows, what kind of provider you are. So, a few of those things. And I know, Justin, you have talked about like less is more. And I mean, that can really help you in a legal case too.
Yeah, that's been, I kind of grew up in the ER, you know what I mean? And that's kind of
Mm,
just how it's done in the emergency department. I mean, that's kind of like how a lot of the ER docs trained me. They were like, less is more. Be thinking to yourself, you are a lawyer and you're looking at this chart. The more you have in there, yes, it could cover you. But on the other side of the coin, though, the more you have in there, the more they can use against you. And
right.
so it's a double-edged sword. I've
It
talked to
is.
it is. It's a double-edged sword. I've talked to a few malpractice lawyers, and it's honestly an opinion of theirs. A lot of them
Mhm.
say chart, 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 and other ones say chart the minimum amount and don't ask questions you don't want answers to. And so,
Right.
in my opinion, that's what I do. That's how I've always charted. I don't ask questions I don't want answers to. I just
Mm,
don't. Why would I ask that question? I don't want to know what the answer to that question is. Why would
yeah.
I ask it? And then why the hell would I chart it? You know what I
Yeah.
mean? There was
Yeah.
an interesting malpractice case that I read about. Guys, happened years ago. And this nurse practitioner was working at an urgent care or something. It was like during flu season or something like that. Really, really
Mhm.
busy, probably burned out.
Mhm.
And I guess some 22-year-old college kid or something came in, running a fever, cough, congestion, like typical like bronchitis kind of symptoms, typical URI, flu-like
Mhm.
symptoms, right? Something that you see on a daily basis, dozens of times working in an urgent care, right?
Mm.
And so this patient comes in. She diagnosed him with, I don't know, whatever it was, bronchitis or whatever it was, gave him some steroids, an inhaler, cough medication, whatever it was. But she documented, are you having chest pain? And she documented, yes, in the review assistance, that chest pain was
Mm.
positive. And so I think the kid ended up dying of myocarditis or pericarditis or something
Oh.
like that. Yeah. And then, anyways, obviously the parents sued,
Mm.
obviously. And the determining factor in the lawsuit was her documenting chest pain and not doing an EKG.
Mm. Yeah.
So if you wouldn't have documented it, you probably would have been okay. I'm
Yeah.
not saying that the outcome, I mean, it's a crappy outcome. I mean, I
Yeah.
don't I don't hope that on anybody, but
Yeah.
things like this happen. It's life.
Yeah.
Like, even if she would have done the EKG, would it have found anything and would it have changed the outcome? Maybe,
Yeah.
maybe not. Who knows? Nobody knows. Right.
Yeah.
And so
Yeah.
that's why I'm like, less is more. Why ask the question you don't want the answers to?
Yeah. Yeah.
Yeah. So,
Exactly. Yeah, that's a good example. And I also think like one of the reasons why providers get sued is, if they're rude or if they don't explain instructions or if they don't, take the moment to call the patient back or, if the patient doesn't feel like they care. And so that's like a huge reason why providers get sued. So if you can just explain to the patient and take that extra moment and, just be a little more cognizant of that. I mean, that can help save you in a malpractice suit also.
oh,
Because there probably
100%.
wouldn't be a malpractice suit if, the patient understood correctly their condition.
Yeah. I couldn't tell you how many times I've heard that in the ER. That doctor's an asshole. I'm going to sue him. Like,
Mhm.
I've heard that so many times.
Oh, yeah.
Interesting. Okay. Well, no, it sounds like you're doing a really, really good thing here. I really appreciate what you're doing. I think that, the articles, the resources that you're providing, I think it's really beneficial thing for nurse practitioners. I really do. I agree with you. I think that if the majority of nurse practitioners can really get their charting down, I think that that would definitely help with the burnout and just their
Mhm.
overall time and enjoyment out of their career.
Mhm.
So I tend to agree
Mhm.
with you on that. But also at the same time, though, I think there's some things that are completely out of our control. Like, if you have a job working at urgent care or whatever for a corporate health system and the market's saturated and you're
Mhm.
just lucky to have that job in the first place and you're a single provider seeing 50, 60 patients a day. I mean, what do you do? Because the administration knows they can just find someone else.
Right.
So I
Yeah.
mean, how do you
That
deal with stuff that's out of your control? You know what I mean?
yeah. That's when you start your own business through the Elite NP.
Now, that's when you get the middle finger to the system and then start your own business. Right, right. That's exactly what you do. Yeah. I think that's really the only way to be fully professionally, just fulfilled as a nurse practitioner. I just don't know
Mm.
any other way to do it.
Yeah.
Yeah.
So one of the reasons why I went into healthcare was because I wanted to make a difference in that
Right.
patient's life. And I
Right.
thought, I would have the time to sit down with the patient and that they would be willing to accept my medical advice and treatment plan. And I learned pretty quick that you don't have the time and that patients don't really care about, treating their diabetes through diet and exercise or something like that. And so I just kind of always felt like I wasn't fulfilling like that need or that passion. Through the burned out NP though, I feel like I've met that. I mean, I feel like I'm helping nurse practitioners, make a difference and that just feels way different than working in healthcare.
You and me both. I derive so much more satisfaction. I feel like I'm helping more people through the NP than I ever did working as a
Mhm.
NP. Yeah. Like my men's health clinic or even doing medical cannabis evaluations, I honestly get more praise, more satisfied patients, more thank yous and stuff doing those things than I ever did working urgent care or ER ever.
Mhm.
I
Yeah.
think there's really something to say about concierge cash practices. You can really spend time with the patient.
Oh yeah.
You can
And the
sit down for
patient, that's what they want,
you're
that
right.
they appreciate that. Yeah.
Yeah, oh, 100%. I mean, I'm sure you've seen, providers before, the ones that really take their time with you. Like those are the ones that you remember. You don't remember the one that was
Oh
in and
yeah.
out of your urgent care visit. You don't remember those people.
Yeah.
Yeah,
And like we
yeah.
talked about earlier, the modern healthcare system makes that very difficult to, treat your patients how you want to.
It's impossible. I don't know how you can. But yeah, anyways. Well, is there anything else that you would like to talk about?
I don't think so. I think we covered some good topics.
I think so too. I think what you're doing is really, really good. So appreciate you coming on board. I like to end the episodes with you asking me questions. Is there any questions that you would like to ask me?
Well, in regards to like online courses, what would you say has been the most successful elite NP course and also the most enjoyable to make?
Well, those are two different courses. Yeah. The most successful course has probably been the IV course. It's probably been our most successful one, interestingly enough, which is
Mm,
surprising to me. That or the men's health courses and the weight loss courses have also been pretty popular too. So they're about even. But the Ivy course has just sold a little bit more, has been a little bit more popular. The most enjoyable course though I've created has probably been the How to Lower Your Taxes course or the coaching course. Like I really enjoyed
Oh,
making those
really?
courses. They were fun. Like they just were
Oh,
like, because it wasn't like a medical topic. It wasn't a clinical topic. Like it was me
mhm.
being able to like talking about how to lower taxes. You know what I mean? How to like really increase your income, or like the coaching course, consulting course, like how to truly market an online business. Like I'm just really passionate about those two things. So those courses were just super fun to make.
Oh, yeah, and they're very informative too. I've done both of those, so
Yeah.
thank you.
Yeah. Yeah, absolutely. Were you able to lower your taxes?
Working on it, yeah. Some of those things, I mean, you don't learn about or, your CPA is not gonna always know that information or offer that information, and so, yeah, it was very helpful, very interesting.
Oh, yeah, absolutely. Most accountants, I mean, some people put, all their trust in accountants. You really shouldn't do that. At the end of the day, they're just
Mhm.
data entry specialists. Like you really need to understand how to lower the taxes yourself. Yeah. So,
Mm.
well, cool deal. Well, do you want to talk about anything else, or we're good to go?
I think we're good. I'll just say, you can find me on Instagram and
Yes.
Facebook, and then also my website. So I have two separate, the Burned Out Nurse Practitioner and the Nurse Practitioner Charting School. And then also I do have a Facebook group, the Burned Out NP, that is just full of nurse practitioners who are there to support one another. I think, just being in that community and just like realizing, okay, maybe my clinic isn't so crazy for seeing 40 patients a day. It just kind of helps bring some realization and support to nurse practitioners who are burned out.
No, no, no. I love that. Yeah. Yeah. I think if anyone listening is burned out or needs assistance with charting, yeah, definitely go to your website. What's the URL?
It's burnedoutnp.com and then npchartingschool.com.
Simple enough. Cool deal. All right.
Yeah.
Well, I appreciate you hopping on here, and I hope that people listening to this have found value out of it. So I really appreciate you coming on board and taking your time out of your day.
Yeah. Thank you for having me.
All right. Awesome. All right. Take care. All right. I hope everyone enjoyed the conversation with Erica, with the burned out nurse practitioner. I think what she's doing is really, really great for our profession. Charting school she just launched. I wish her the best success with that. I think that's a really, really needed course for a lot of nurse practitioners out there. So, listen, if you're burned out, there is a way out. Okay. A lot of people, if they consider getting out of nursing completely, just quitting becoming a nurse practitioner, going back to the bedside, or just getting out completely. But there are ways out of it. Worst case, you leave your job, you start your own business, or find another job. I mean, that's pretty much the worst case. Find something else, you know what I mean? Or you do a lot of the tips that Erica was talking about. Figure out how to have more you time, making your charting more efficient, like doing things that give you back the most valuable resource of all, and that is your time, all right? When you are spending so much of your time on work, life starts becoming somewhat meaningless. It starts becoming mundane. It starts becoming boring. You start turning into your work. You lose your identity, right? This has happened to me. It happens to a lot of people in healthcare. It happens to a lot of professionals. All they know is work. All they talk about is work. All they think about is work. You don't want to be that person, right? You just don't. And that just leads to burnout. So you got to figure out ways to get back your time. And you could do that through a variety of methods. Making your work more efficient, making your work for you, starting your own business. There's just so many things that you can do to get back that time. And once you get back that time, the burnout should subside, all right? Check out her website, check out her stuff. It's really, really great. It's been a pleasure talking with her, and I hope everyone found a lot of value out of this podcast. All right, talk to you guys later. Thanks, bye. Thank you for listening to the show. Quick legal disclaimer. The content of this podcast is meant for informational and entertainment purposes only and should not be used as legal, financial, medical, regulatory, or practice-specific advice. For information pertaining to your specific legal, financial, medical, or practice-specific needs, please be sure to consult with your lawyer, CPA, medical director, and/or your state's practice laws and the most up-to-date clinical guidelines. As always, do your due diligence when it comes to any information found online and in podcasts. The content in this podcast is copyrighted by Galaxy Medical Southwest 2022 and cannot be duplicated, rebroadcasted, or reproduced without our written permission.